Hey, what's up guys? It's me, ThePsychNPDavidC. So my whole life, I thought I was dealing with like some kind of depression, but it might have turned out to just be low testosterone instead. I always had things like fatigue, low energy, low motivation, but I finally got my testosterone level checked like 2 months ago, and it actually came out pretty low. Many symptoms of low testosterone mimic the signs of depression, so it's kind of difficult to differentiate between the two. A lot of guys experience the same symptoms and assume it's purely depression, but maybe it's not. So in this video, I'm gonna break down how low testosterone can look exactly like depression, how to tell the difference between the two, and when it's worth getting your levels checked. We'll talk about overlapping symptoms, when to get tested, and what the treatment options are. Let's talk about it. This video is for educational purposes only and is not meant to be medical advice. So first, let's talk about what testosterone actually does in your body. Testosterone plays a role in energy levels, motivation and drive, mood stability, concentration and memory, and metabolism and muscle growth. So as you can see, testosterone affects both physical and mental health. And depending on where you look, generally the normal range of testosterone in men is anywhere from 300 to 1,000 nanograms per deciliter. Okay, now let's get into how low testosterone can look like depression. If you have low testosterone, you're probably gonna have fatigue, which can look like emotional exhaustion. You're probably gonna have low motivation, which feels like apathy. You might even have irritability that can be mistaken for depressed mood. You could have sleep issues. You could have loss of interest in something that you used to enjoy. You could get brain fog, which kind of mimics like concentration problems, and maybe even some emotional numbing. So as you can see, if you just took like all those symptoms I just mentioned, someone might look like they're just depressed, when in reality, it could be due to low testosterone instead. Now we'll go into some of the psychological symptoms of low testosterone. You can experience things like poor stress tolerance, less emotional resilience, reduced confidence, difficulty initiating tasks, trouble maintaining momentum. You might have like a chronically low or depressed mood, which is definitely going to have an impact on your relationships. And once again, if you take all these symptoms and you just apply it to somebody, you might just think they're just depressed. Okay, now let's go into physical symptoms that can actually differentiate low testosterone from depression. If you have low testosterone, you might have decreased libido, erectile changes, usually erectile dysfunction, low muscle mass or loss of muscle mass, an increase in body fat percentage, muscle weakness, lower stamina during your workouts. So if you're experiencing some of these symptoms in addition to the other symptoms that we mentioned earlier, you might have low testosterone. So these physical symptoms are a big clue as to whether you have one or the other. And this is something my urologist told me, which kind of stuck in my mind. He said the difference between low testosterone and depression is that with low testosterone, you want to work out, but you feel like you don't have the energy to do it. But if you're depressed, you just don't want to work out in the first place. Okay, now let's get into when someone should consider getting their testosterone levels checked. First, if you experience like new onset fatigue without a clear cause, because usually when we experience fatigue, we know what's causing it. Like maybe you didn't get enough sleep last night, or maybe you're jet lagged, or maybe there's just other things going on in your life that make you fatigued. So if you just get fatigued out of nowhere, it might be low testosterone. Another big one is that your mood changes don't respond to antidepressants. Now, this is actually what happened to me since I thought I had depression. I tried many different antidepressants like Lexapro, Zoloft, Wellbutrin, and they barely did anything. Like to the point where I thought it was just like placebo effect. So most recently, I was on Wellbutrin for like at least 6 months and I didn't feel any noticeable change. So that's when I was like, maybe I'm not depressed. Because I was still having things like depressed mood and low energy. Another one is libido changes. If your sex drive goes down, it might be worth getting checked out. Another one is struggling with strength despite consistent exercise. Like if you're working out like 4 to 5 times a week, your diet is on point, but you're still not making much gains, it could be low testosterone. If you're a male over the age of 30, you should definitely just get it checked out just because. I read that after age 30, the testosterone level in men drops about 1% every year. Honestly, if you're going in for like your annual health exam and you're gonna have your blood drawn anyway, you might as well just ask your doctor to include a testosterone test. Okay, now let's say you get your blood drawn and you actually have low testosterone. Let's get into some of the treatment options. So there's a lot of lifestyle factors you can do before you consider like testosterone replacement therapy or TRT. You can do things like exercise, getting better sleep, reducing alcohol intake, Make sure you're in a healthy weight range. So doing all these things will probably increase your testosterone levels a little bit, but if you have like super low testosterone, it's not gonna like boost you up into the normal range. And then assuming that you already do all these lifestyle changes and you still have low testosterone, that's when you should probably consider TRT. I'm not gonna go super deep into TRT, but basically you inject yourself with testosterone, whether it be through like gels, patches, injections. That's gonna significantly boost your testosterone levels. Okay, so now I just want to briefly share my experience with TRT. I've been on it for about 60 days at this point, and I do notice a pretty big improvement in like mood and energy level and even like muscle growth. When I told my doctor I had things like low mood, low energy, decreased libido, we made sure to rule everything else out, like iron levels, thyroid levels. We ruled out sleep apnea. I did a sleep study test. I've already been on an antidepressant and they don't do anything. And then when I finally got my testosterone level checked, I came in at 303. So it was definitely on the low side, and I really think this is what's been causing my low mood and low energy pretty much throughout my life. So if you feel like you're depressed and like nothing's working, I would definitely suggest getting your testosterone level checked. I'm gonna do a separate video regarding my experience on TRT. Make sure you subscribe so you don't miss that. If you found this video helpful, make sure to like. It'll help a lot of other people know the differences between low testosterone and depression. I wish I knew these things a lot earlier in my life. I'm also on TikTok and Instagram if you want to follow me over there at ThePsychNPDavidC. I do medication management for adults living in California. If you're interested, there's a link down below. And with that, your mental health just leveled up. You're welcome.